Now, I quickly want to move to another aspect of fetal talks. So this is what is known as a fetal heart sounds, like auscultating for them. Alright, so auscultating for them is basically you are trying to confirm that fetal heart sounds actually exist. Now, there are different ways you can be using a stethoscope. You can be using this ultrasound, mobile ultrasound. Then you can also be using this thing, this traditional tool that is still being used today. So first, of course, the reason why you're actually picking up the fetal heart sound is you want to actually ensure that a baby is there, the heart is beating, everything is okay. You understand? So it's a vital clinical technique. Okay, so it's used to monitor the well-being of the baby. Of course, I'm checking out for the heartbeat of the baby because I want to actually confirm that the baby is doing well. So it involves listening to the baby's heartbeat using specialized tools. Now, those are the tools that I kind of like listed them out before we started. You understand? So what is auscultation? You are trying to listen to internal body sounds, okay? And in pregnancy, or in this case, is the heart sound that you're actually trying to focus on. Right? So you focus on dictating the fetal heart rate, and the fetal heart rate is very fast, about 110 to about 160 beats per minute. You understand? So that's it for this. So tools used for this auscultation, like we spoke about, the Doppler ultrasound device. This is this one. Okay, stethoscope. All right. Then stethoscope is different. Okay. Then Pinard horn. This is a Pinard horn. Okay. Then electronic fetal monitor. Okay, they didn't actually state of the stethoscope because stethoscope will pick up other sounds more. All right, stuff like that though. Okay, so when is it performed? Early pregnancy, you can dictate heartbeat from 10 weeks. Mid pregnancies between 18 to 20 weeks. Then you can say at the latest stethoscope here, right? So you can actually use stethoscope too. Then also labor, that's just continuous intermittent auscultations. You're just trying to keep monitoring, ensuring that the baby is well. So clinical significance, it confirms that a baby is there and the baby is alive. It monitors if the baby is going into distress, because as I'm monitoring the heartbeat, if it is becoming slower or if it's becoming too fast, it shows that there's a problem. So it tracks fetal development, then provides reassurance to mothers that are expecting babies anytime soon. Right? It helps to calm down the situation and reassure you that your baby is fine, okay, doing very well. So that's it for auscultation for fetal heart sounds.